I don't know if we can see this. Maybe you can. But you can see, thank you so much, Brendan, you're doing a great job. When I take a look at her, if you look at her from below and I'm looking at her from above, you see that this columella, the strut of the nose, it's going this way, right? So it's angled like this. Do you see that angle? And ideally, that nose should be like that, should be straight. And she knows that I've done this before, so she's putting me to the test to see if I can do it again, right? The other thing that I noticed, she has a beautiful profile. Our product is still sitting in there from last time. It's amazing, because in the nose it'll stay for years. But I notice as well, if you put your head down, and I don't know if we can get to see this, do we have, oh, so smart, thank you. I'm going to wet it up here a little bit, and maybe it'll show a little bit better. But she has a little curve to her nose like this as well. You see how she's indented here a bit? And the nose is doing this. Because you broke it. That's right. Okay. So what I have to do is I have to use the light reflexes to try to create an image that the nose is perfectly straight. The other thing that they did, chin up, okay, so they used this and a rim incision then. Okay, not a problem. Well, maybe, but we'll see. Shouldn't be. And what she has, as you can see on this side, is a notched nostril. That's a giveaway that she's had surgery done. Can I do anything for that? I can, and luckily Sebastian's not here, because every time I do it, his heart stops. He turns white, but we're going to try some things on her. I'm going to show you a couple little tricks. These are advanced techniques. I'm showing you that they can be done, and the thing is that if you're rather a bit of a novice or intermediate, don't jump into this stuff right away. And certainly if you're going to try it, go after your family. Don't go after, go after patients originally. So the first thing I'm going to do is I'm going to try to balance out the light reflex on her nose. And it's doing this little jiggy thing. Outline, pure. Okay? I do not use blended product for this because I want to use pure product with Lido in it. And I don't want to use anything that I blend in a little bit of epinephrine to prevent bruising, because if her nose blanches, I'll blanch. And her nose will blanch. So be prepared. For those of you who are weak at heart, go for your biological break right now. Okay, that's why I'm laughing about it, but we're going to be good about it. So, when I look over here and I see that it's jigging like this, I have to elevate the side that in order to make the nose look straight. Nasal injection should be done in the midline always. If you're going to be in the midline, it's midline and deep. I don't have the anatomy for that. I have a whole discussion on that. But there is a little gap between the perichondrium and the periosteum, and where the tissue is above it that contains the blood vessels. It's a very small little gap, and so you got to stay midline. But when I look at her on profile, let me turn your head this way so they can see it. She's got a perfectly straight nose. I don't want to augment her nose and give her a bump. What I want to do is I want to try to give it the impression that the light is straighter. So I'm going to be going just off midline right about over here. That's where the dorsal vessels are of the nose. So I'm going to take my couple of aspirins and my Valium, and what we're going to do is we're going to do this. We're going to take the nose and we're going to push the skin into the needle, and I'm in the dermis. You can see how superficial I am. And I'm going to use the base of my thumb to inject a very small amount of product. Just like that. And then out I come. Okay? And what I'm doing is I'm trying to elevate that part so that you see the light reflex going straight on her nose. Let me look at you. And for this indentation that she has over here, I can't go down on bone there because we have the alar artery. That is very often the end of the angular artery or facial artery. So I've got to go superficial again. And this is an article I wrote on superficial injections of the nose. If you want to have a heart attack, you can read that article. Push it into the needle. Slow injection, monitor the skin. You'll see the skin start to blanch a little bit. You come out. Little stick again, into the nose. You're doing great, Galit. Another little one, into the nose, skin. Slow injection, and then out it comes, and then a gentle massage. Okay? We're building up this side of the nose where it collapsed as a result of her break. Do you see how we're getting a straighter dorsum to that? She doesn't look curved, but she still has this nose that's deflected that way. All right, so now we do the crazy thing. 2 little injections that are left. You know the story here. Turn your head to the side. Just like that. You okay? You're good? Did I bring a tear to your eye yet?
No.
Not yet? It's coming. Here we go. So what happens is you have what we call the membranous septum, which is very mobile over here, and then you have the real septum, which is behind it. I'm going to try to strut the membranous septum. This is what we do in surgery when we take out a piece of cartilage from the ear or from the septum and we try to make a nose go straight. So what I'm going to do is the side that the nose is deviated to, which is this side here, I'm going to create a little strut on the inside of the nose. Oh, let's see if this works. So here's the septum over here. Ready? A little flick. Good. Now I'm underneath the mucosa over here, and I'm injecting a small amount of product. You keep breathing, and I'll keep breathing. And we inject very slowly. You're doing great, Galit. Really, really well. And after I get a little bit in that has the anesthetic in it, I can go a little bit higher and do the same thing over here. Okay? There we go. Almost. Almost, almost, almost. One more, sweetheart. One more. You all right? You feel nothing? That's because I've numbed it up already. There we go. Chin up. We're almost there. I still need a little teeny bit more, Kat. Okay, I'm just trying to push it over that much. So what I'm doing is I'm strutting this area to try to go ahead and push the nose over. Okay? One more. Everybody's very quiet. They're holding their breaths. Okay, let me see if I can get you just a little bit more over there. Little flick. It's a little lower. I'll strut it down here. And the reason that I started doing this was because my life was too boring and I wanted to live off the edge, you know, bungee jump or whatever. There it is. Okay. So the reason I started doing this is because when I do rhinoplasties and we put in local anesthetic, which we put in right about over there, every time I put the local anesthetic in, I would notice people's noses, patients' nose starting to straighten. So I said, why don't I do that with filler? It lasts about 6-9 months. So if a patient comes to see me for rhinoplasty and I can't get them into the operating room for about a year, I'll keep them happy by doing this for a while. And now, let me look at you. Okay, I'm going to the other side of the bed. Here we go. You ready? Mm-hmm. This is outline, right, Kat? So, put your chin down. You see the way this is notched more than the other side? That's the typical rhinoplasty notching, because as the scar heals on a rim incision or from an endonasal incision, it pulls the nose up like this. So we're going to force it down. Okay, here we go. I'm going to try to keep my hands out of the way, and what you're going to do is you're going to feel a little flick, and you don't like that, but I'm in there, okay? Here we go, and I'm putting in a little bit of product very slowly, and advancing the needle, and I'm beneath the lower lateral cartilage rim, which is right here, and I'm pushing against that rim to force this part of the nose down. And you're going to see it blanch. And you're going to see me blanch. But this is the technique to go ahead and to adjust that. Okay, you see the blanching that you have over there? I'm going to go a little bit more over here. Good girl. I'm trying to keep my hands out of the way so they can see what I'm doing. There we go. You see how it's lower than the other side now? Damn it, I got to do the other side now too. Okay, and look at the blanching on the nostril. You having palpitations? Okay, I don't mean to belittle this, What you do is you massage. The blanching that you're getting over here is blanching as a result of pressure. Okay? I don't believe that I hit a vessel over here, but whenever you do this, you do not let a patient leave your practice for 15 minutes after you do nasal injections. And you must make sure that the skin has all recuperated from it. So we're going to check this, and you can see how it's starting to get back its color now. As I press on it, you can see now that the area is getting smaller and smaller. Okay? Or am I imagining it? No, it is. You can see that. Now it's just a little area, little massage. So I've used about 0.05 of product just to do that. Are you going to charge for 0.05 of product? I hope not. That's why you come up with a price for the technique that you're doing. And this is where you have the biggest markup in your practice. But, okay, you just got to be sure that you're comfortable in doing these types of things. Look at the way that nostril is way down now compared to the other one. Do you see that? Put your chin down, maybe they can see it a little bit better. Yeah, you can. And this is a much more natural looking nostrils here than one that is, I keep on looking at the camera, it's backwards. One over here that's notched up. Do you see that? Okay. Or maybe I'm just imagining things. They don't see a thing. Could be.